Welcome to your lecture on bones of the head and neck. We will be discussing structures that we find on cranial bones as well as facial bones and the cervical vertebrae.
So first I want to mention that there are a total of 22 bones within the skull, and we're going to start off with our cranial bones. There are going to be 8 bones total, and throughout my lecture you're going to see these numbers in parentheses. Don't worry about those, they just correspond to a Netter text where I got these images from. So just to summarize, we have our frontal bone, our parietal bone, which you see all of these are color coordinated, so you would see that in the green. Our temporal bone, which would be in the pink over here on the sides, on the lateral sides of the skull, and the sphenoid bone. You could partly see this in the anterolateral portion, but we'll see a majority of this inside the cranium. The ethmoid bone, which you see in the gray a little bit over here. Again, we'll see a better view inside the skull, and the occipital bone, which is found most posteriorly. So first we'll start with the frontal bone, and the word frontal came from the Latin word frons, meaning brow or forehead. And if you look at this supraorbital margin, you're going to see that there's a notch, which we call the supraorbital notch or supraorbital foramen. Now 75% of the time we have a notch, and the other 25% of the time you will have a foramen. So you could kind of feel your own supraorbital margin to see if you feel a little give in that area, then you have a notch. If it feels nice and smooth, that means you have a foramen. Next we have our parietal bone, and the word parietalis, which is Latin, comes from the actual meaning wall. So this parietal bone makes up the wall of the cranium. Next we have our temporal bone, and this is our weakest cranial bone here, and temporal comes from the Latin word meaning time, tempus meaning time, and so they thought that when people grew older they only left hair on the sides of their skull here, and that would be a way of showing your time. So there are 4 parts on our temporal bone. First we'll discuss the external acoustic auditory meatus, then the mastoid process, styloid process of the temporal bone, and the zygomatic arch with the zygomatic bone. So here we see an opening. There's a little, almost looks like a hole on the skull, but it's actually a canal. The word meatus means canal, and that's why it was named so. Next we have the mastoid process. Oh, before we go into that, here is a view of what that external acoustic meatus looks like. So this opening right in here is what we're seeing within the skull, so you could see how it leads into a canal, although we have some subcutaneous tissue and cartilage that is going to form the external portion of this external acoustic or auditory canal. So next we have our mastoid process, and the word mastoid means breast, and so anatomists thought this looked like a breast here. And we have a very important muscle that attaches to this mastoid process, and that is the sternocleidomastoid muscle. So it's this big, thick muscle on your neck. If you flex at your neck anteriorly, you should be able to see these muscles pop out. Or if you turn your head from left to right or rotating, this muscle will also stand on out a little bit more. We call this a sternocleidomastoid muscle because it attaches to the sternum and the clavicle, that's the cleido portion, and mastoid, of course, attaching to the mastoid process. And lastly we have, we got 2 more left. We have our styloid process of the temporal bone, and this kind of looks like a shark's tooth. This naming styloid came from the word stylus, meaning pen. So if you remember way back in the day before we had smartphones, people used to carry Palm Pilots, and it came with a stylus, and that stylus would be kind of like a pen. It's pretty analogous to, I think Apple came out with like an Apple Pencil or something. But anyway, it's like a writing utensil. And next we have the zygomatic arch with the zygomatic bone. Zygomatic really means to yoke or to pair up, so this is pairing up with the zygomatic bone, or the zygomatic bone is pairing up with the temporal bone. You could look at it both ways. But all in all, this is called your zygomatic arch, and because it's your temporal bone here, we say it's with the zygomatic bone. So it helps to create our cheekbone, which you see right in here. Next we have your sphenoid bone. The word sphenoid means wedge, and I don't want you to think of a door wedge. Instead, I want you to think this sphenoid bone is wedged between the cranial bones up here and the facial bones. So this is our wedge bone between the cranial and facial bones. Have it written right there. And it resembles a butterfly, and I'll show you what that looks like in a moment. And we also have 4 different parts to the sphenoid bone. We have a Sella Turcica, a greater wing, lesser wing, and pterygoid processes. So first we'll start off with the Sella Turcica, and that's that black portion I've outlined over there for you. This Sella Turcica, now we're looking at a superior view. So what I've done is cut off the calvaria or the skull cap so that you could see into the skull with the brain removed. And the Sella Turcica is right over here. So this region is where we are going to have the pituitary gland sit, and the shape of it is a Turkish saddle, and that's exactly what Sella Turcica means. So this is what a Sella Turcica looks like. It's a little bit higher in the back than it is the front. And here's it in view, some images for you. Here's a Sella Turcica over here, and you can see the pituitary gland right inside of it, and right in here would be where your Sella Turcica is as well. And we could see our pituitary gland sitting right inside of it. Next we have our greater wing, and this is really the portion that makes it look like a butterfly or bat's wings. And this would be our lesser wing. So if you see this in a skull, this greater wing actually sits down a little bit more inferior than the lesser wing. And the lesser wing is kind of a triangular portion of the sphenoid bone. Lastly, we have the pterygoid processes, and really we're thinking of the word pterodactyl, like that means wings. So when we look at this on an inferior view of the skull, we have 2 different wings here. We have a lateral plate, a depression in the middle, which we call the pterygoid process, and a medial plate. So that's creating our 2 wings, and this is just another view for you here. It's a sagittal cut through the skull, and you can see the medial plate here, and here's the lateral plate of those pterygoid processes. Now we venture into the ethmoid bone, and here we're looking at a superior view of the skull with the calvaria cut once again. There's my ethmoid bone. The word ethmos means sieve, so I want you to kind of think of like a pasta strainer, and that's what this bone looks like. It has a ton of holes within it, and that is to allow some olfactory nerves to move on down. So we have 2 different parts here. We have our cribriform plate, okay, which is the flat portion that has all the different holes in it. And as I mentioned, this cribriform plate has all those holes in it so that we can have our olfactory nerves move through those holes and pick up any chemicals that we are smelling from the nasal passages. The other part is named the crista galli, and now this is a sagittal cut of the skull, and it's going to be this shark tooth, once again, shark tooth looking like structure over here. And soon we're going to talk about some dural folds within anatomy too, and we have a dural fold called the falx cerebri that's going to attach to this anteriorly. So that's the main functioning of this bone structure being there. Next we have our occipital bone, and the word occipitum means the back of the head, and occipita means to begin or commence. So this is one of the first bones to begin developing as we're in the womb. And we have 4 different parts here to our occipital bone. We have the external occipital protuberance, foramen magnum, the clivus or the basilar part, and the occipital condyles. So you could see that there's a black arrow pointing to the external occipital protuberance here. It is also called the occiput. And if you feel the back of your head, that part that sticks out just a little bit more than the other is your external occipital protuberance. Next, we have the foramen magnum, which broken down, foramen means whole and magnum means large, right? So this is the large hole of our skull, and this is where our spinal cord is going to transmit. So here is our foramen magnum, and we could see that this spinal cord is moving on down. Don't worry about this part, this is abnormal. Next we have our clivus, or the basilar part, and now we have the superior view into the skull once again, and it is this portion. It kind of looks like a slide, like you would slide down into the foramen magnum, and we also call this the basilar part because when we discuss the circle of Willis, which is the blood supply to the brain in the skull, the basilar artery sits right on top of this area. So I'm giving you a view of this. Right over here, this is our basilar artery right in here, sitting on top of the clivus, and you could kind of see that you would slide on down into this area, and there's our foramen magnum. Next we have the occipital condyles, and that is the knobs found on the occipital bone here. These are really important structures because they are going to make contact with your first vertebrae, C1, which is also known as atlas. So in here, it's kind of difficult to see in this image, but we're going to learn about this portion of your vertebrae in your next lab list. But your occipital condyles are articulating with the superior articular facet and process of C1. So I think I have another image here. Here is your occipital condyle, and this would be the superior articular facet of C1 articulating there. So it's that first contact with your vertebrae stacking on top of one another. This portion sticking up here, this is actually a part of C2. So now we're going to start on your facial bones. We have your maxilla, palatine bone, lacrimal, zygomatic bone, nasal bone, vomer, and your mandible. So first we have your maxilla that you could see all in the green, and it makes up your upper jaw. And the one structure we need to know here is the infraorbital foramen. And so these are going to be the holes found below the orbits. Next we have your palatine bone, and this is quite an interesting bone here because we can even see it within the orbit. So you see it back in here, but really the best view of this is going to be, if you look at an interior view of the skull, you'll see that it makes up the posterior 1/3 of your hard palate. And this is another sagittal cut view here, where you could see that it makes up that posterior 1/3 of the hard palate. What makes up the anterior 1/3 of, anterior 2/3 of your hard palate is going to be your maxilla. Next we have your lacrimal bone, and the word lacrimal means tear. So anatomists thought, oh, this is, the area, this bone is in the area where your tears come from. But later they realized the gland that actually produces the tears is on the lateral portion of your orbit, and then it drains the fluid over the eye and then will come out through the lacrimal punctum here. And then any excess fluid will move into the canaliculi through the lacrimal sac and through the nasolacrimal duct, and that's why you sniff when you cry and you get an overproduction of tears. Next we have our zygomatic bone, and as I mentioned earlier, this makes up your cheekbones, or helps make up your cheekbones. Zygoma, means to yoke or a bar joining. So you could kind of see how the zygomatic arch at this point is joining the zygomatic arch on our temporal bone to create that cheekbone. The zygomatic bone itself makes up the anterior portion of our cheek though. Next we have our nasal bone. This is actually made of two separate bone pieces, both known as your nasal bones. Right over here creates the bridge of your nose. And the rest of your nose, of course, would be made up of cartilage, hyaline cartilage. And we have your vomer as well. This you could see in your skull is going to be that middle plate or the septum of the nasal cavity. And this was named after an old plow that they would call the vomer that would vomit up the the earth. So this bone means to vomit. And that's the shape that this bone is in. This is the vomer disarticulated here. And here we have the mandible, which would make up your lower jaw. Mander means to chew. And we have another hole to know here. That is your mental foramen. The word mentum means chin, and that's why it was named so. But I always kind of stroke my mental foramen when I'm in deep thought, so that kind of helps you remember mental foramen. And your condyloid process, which is a part of your TMJ, or also known as your temporomandibular joint here, is also a part of the mandible. And there's your mental foramen. Here's your TMJ, a close-up look here, and you could see your condyloid process coming together with what's known as your mandibular fossa on your temporal bone. I left this part out of your lab list, but I thought it'd be good to know. But we have some bones that are a part of your orbit, and the way you can memorize this is please let me eat zucchini for supper. So P stands for your palatine bone, L stands for your lacrimal bones, me stands for your maxilla bone, eat is for your ethmoid bone, zucchini is for your zygomatic bone, 4 is for the frontal bone, and S is for your sphenoid bone. And the last thing we're going to talk, oh, not the last thing, but second to last thing we'll talk about are the sutures of the calvaria, or your skull cap. So your coronal suture connects your frontal bone with your 2 parietal bones. And these sutures are joints. They're just immovable at this point because we have gone through the ossification process and don't have any fontanelles left. Next, we have your lambdoid suture that's found posteriorly, and that is connecting your occipital bone with your 2 parietal bones. You have your sagittal suture here that sits between your 2 parietal bones, and to see your squamous suture, we have to take a look at a lateral view of the skull. Just to review, here's your coronal suture, here's your lambdoid suture, and then we can now see your squamous suture, and that really sits between your parietal and your temporal bones. And the last thing we're going to talk about are your bony sinuses. And a bony sinus is an empty space within bone. It is lined with mucous membranes, and we have them named according to what bone they sit within. So first we have your frontal sinus that's located within your frontal bone. We have your sphenoid sinus, which you don't see the best here. I think I have another slide with a different view for you to see that. We have your ethmoidal sinus over here. They're more like air cells. They're little pockets of bony sinuses. And then we have your maxillary sinus, which is the largest of all the sinuses, and it sits within your maxilla, which would be above your upper teeth. So sometimes when you have some pain within your teeth, it's an issue with your maxillary sinus. So here's another view of these sinuses. We have your frontal sinus here. Your sphenoid sinus actually sits below that Sella Turcica. Let me orientate you again. There's your Sella Turcica, which the pituitary gland sits in, and there's your sphenoid sinus. The air cells would be located lateral to this area here, which is not pictured. And then here's another view of your ethmoid sinus and your maxillary sinus, and a better view of how the maxillary sinus sits in relation to your upper teeth. So you could see how if you have some issues with your sinuses, inflammation and infection, that's going to affect the nerve endings within your teeth.
Now we're going to talk about the bones in our neck, starting with the cervical vertebrae.
Remember, when you come amongst a vertebrae, the first question you're going to ask yourself is, does it have a transverse foramen? So you look at those transverse processes. Is there a hole within it? And what is that hole for? We'll get into this a little bit more in your cardiovascular system, but coming off of your heart, you will have your subclavian artery. And off of that subclavian artery, you will have a vertebral artery, and that's what these transverse foramen are for. This vertebral artery will move through all of the transverse foramina and eventually through the foramen magnum and into the skull. So it joins this right vertebral artery is going to join the left vertebral artery, and they anastomose, meaning these vessels come together and they're going to form a basilar artery that sits on the clivus of your occipital bone. So that's what's going through the transverse foramen of your cervical vertebrae. Now, your cervical vertebrae also have very special vertebrae, and that first one, C1, has a special name to it called atlas. It has no body and it has a articular facet for the dens, which would be on this anterior surface here. This would be more posterior. And C2, your axis bone, is going to have a special projection here, and that is called the dens or the odontoid process. And those terms, dens and odontoid, mean tooth-like. So anatomists thought this looks like a tooth sticking up on axis. Let's call it the dens and odontoid process. And this is how they fit together. So around here you could see the atlas, again no body here, and there's our articular facet for dens, and the dens on C2 is articulating exactly there. So this is more of a posterior aspect, and you could see the spinous process of axis, whereas this is more of an anterior view of dens. And the last cervical vertebrae we'll talk about is C7, which is named vertebra prominens, and that is because it has the most prominent, longest spinous process of all of them. And if you feel the back of your neck, you're going to feel a very prominent bump once you get to the base of your neck, and that is C7 there. So it's quite a landmark for counting vertebrae.
Now we can't forget about our hyoid bone. The hyoid bone is going to be found in the neck between our mandible and the larynx, and it's there to support and provide attachment sites for some of our tongue muscles. We have some lesser horns, which are indicated by my pointer, and also the greater horns that go on back. So you may notice that this looks like a horseshoe, and this is the body of the hyoid bone that would be anterior. So I just wanted to give you a perspective of how it supports and provides attachment for some of the tongue and neck muscles. So you can see some of the muscles more superiorly. Here's our hyoid bone, and inferiorly we have some of our what we call strap muscles of the neck. And this hyoid bone is suspended. It doesn't connect to any other bone in the body. It is suspended by 22 muscles and ligaments. So that is it for our bones of the head and neck. Please let me know if you have any questions, and enjoy the rest of your day.